I studied medicine in Venezuela, where I born. I graduated in 1998. So I have been seeing patients for 26 years, and I just didn't see patients while I lived in Hungary, and not just the weather and the languages, because I was earning good money in MIP, but I really miss the patients.
Need you put this microphone down?
Sorry. Is it the other way around, or it's okay?
This.
Aquí?
Yeah.
Here.
That's
Okay.
just for the recording.
Okay.
Yeah.
I'm sorry.
That's okay. Thank you.
Okay, so but since I graduated, I always thought, because allopathic medicine, the one that I have studied 7 years at university, always improved in diagnosis. I think, for example, we have very new kind of diagnosis, a new scan, almost a pill I can take and will take pictures, but for the treatment it's almost the same. If we have cancer, we go for chemo, radio, and surgery. If we have a gastritis, we go for the same tablets, or ranitidina, or omeprazole and suprazole. And for years, the pharmacists just change and put maybe another ingredient in the tablet that doesn't maybe bother so much, but it's the same. So I say it's not possible. There must be another ways to heal, to be healthy again, but more natural, and not only cultures like Maya's cultures or Chinese culture can be wrong for so many years. So I started, never left completely the allopathic medicine. That's why I call it integrative medicine, because I like all what I learned, the biochemistry, the histology, the embryology, that's very important, but also what I learn now, ozone therapy, neural therapy, swarms with vitamins that I can feel the difference in myself if I have vitamin C or vitamin B, how my body responds maybe without another medicine, but my immunologic system gets better and I'm out of a flu just with vitamins and minerals, also because a flu is a virus and the virus will kill themselves. I mean, he will bother until some time. It's not a bacterial that needs something that you kill it. A virus will have time in our body, and with or without medicine, normally will go like a flu, and so all what I have studied, I just integrated in a consult that I think is more harmonious and more respectful and more human and very specific and individual for my patients. It's not that I have a problem with my throat, I will send it to the otorrino. I have a problem with the gastritis, I say no. If you are a studying person and thinking person, the specialties are important, are very important, and thanks God they have developed new ways of surgery or things like that. But normally in a normal consult, 95% of the consult can be managed by a general doctor that really likes to be with their patients, so I have studied that kind of therapies also to work in, I don't know, in Spanish is medicina ocupacional, to work for companies, for different companies, and to teach too. Like in Venezuela, when you want to teach and you're not a teacher, even if you have another profession, you need to study to teach, how to teach, because you can know a lot about a subject, but if you don't know how to communicate it, it's not good for the students. So for all my life, I have been between my patients and doing this talk or teaching in some schools, or doing maybe 3 of those things before I needed to leave Venezuela, because the situation came very bad with the time until we needed to have like 3 jobs at the same time. But even with that, it wasn't impossible. It was impossible by that time to leave, okay? So today we are going to talk about pain. If we think it is important to talk about pain, a little bit of history, pain classification, pain management, and also another ways to management this pain more natural. Okay, so if we look what the World Health Organization said about pain, it's an unpleasant sensory and emotional experience associated with actual or potential tissue damage. But it is important to talk about pain? I think yes, because pain has, first of all, a great impact on individuals, families, work, society, and the economy of a country, of course. But also, I don't have statistics here in Mexico, but in Spain, for example, more than 50% of consultations in primary care are due to pain. And this, with the age, goes more. Like, for example, over 65 years old, increase to 50% of the population of 65 years old have a chronic pain. They learn how to live with it, but they have the pain. So yes, it is important. And also it's important because there are more diagnoses that we cannot actually see what is happening with physically with the patient, like fibromyalgia. How can I say that in English? Oh, thank you. And more women with that diagnosis, which is very painful, with lupus erythematosus, lupus, this kind of illness that are always with pain. We are now in a society where more and more women have this kind of diagnosis, okay? So, yeah, I think it is a very important topic to talk. Despite the magnitude of the problem and in medical, scientific and social interest in the care and treatment of chronic pain, this is a problem that is undervaluated or inadequately treated. And why? First, because at the university we don't even have like a specific subject about pain and how we can have the sensitive to treat a patient, because the pain has psychological areas too. So at the university we just study like, oh, okay, something very little, and we continue because there is too much to study, okay? But it's also due to the people, because normally we like to go to the doctor and we give the doctor the right to tell us what to do, like we weren't owners of our bodies. I mean, we say to you, I give you the right to treat me how you think it is good for me. So I have the two important parts. One that say I'm not responsible of what I will take in my body. I will give you the responsibility to tell me what to take. And the other one likes very much because he feels like, the doctor, take this. And if you don't take it, we like very much to say, maybe you did something that I didn't tell you. What did you do wrong? You didn't take it, the pill. That is very nice for the egos or for the doctors, normal, you know? To find a mistake. If it is not working, maybe there must be a mistake or something you didn't do. No? So the history, we know pain has been, through all the history, has accompanied man since his existence. We have pain physically, we have had pain emotional, and well, right now we were talking about how to live with all your family very far. Maybe some of you also are living now here and your relatives are, and that's a kind of pain too. So for all these things, I think pain is a very, very good and interesting topic to talk, okay? Please feel free to tell me or to talk anytime, okay? More than last year, we were more people tired, really. So now it's like, a small talk, you know, like So according to the time of appearance, acute pain is less than 3 months. And chronic pain is when you have a pain for more than 3 months. That's chronic pain. Because sometimes people feel or think that chronic is important pain or that is very, very painful, and it doesn't have to be with the magnitude of the pain. It has to be with the time that appears. So I can have a pain that is not so painful, but if it's with me for more than 3 months, I have a chronic pain, okay? And the opposite, if I fall down and I break my bone, I will have a very strong pain, but that's very acute, because it is from yesterday, since I fall down. Okay, according to the location of the pain, we have somatic pain. It's very acute pain, and it belongs to a place of our body that have been with the damage, okay? And we have visceral pain, which is very difficult even for the patient to explain it, because most of the time it's not very well located, and also can go, the patient can feel that it goes to another places, like, oh, I don't know if it's my back or if it's my kidney, and also the pain like comes here, or for example, if it's the sciatic nerve, they say maybe it's a pain here, but also comes here, and after comes here until my foot, so the pain, no, that's, we're talking about visceral. Sorry, if I have stomach pain, I can confuse it with menstruation pain, for example, and you say, the patient will say, I have something that I feel, but they cannot explain, like the case of the bone, that they say the pain is here, you know? So the somatic pain is very difficult to explain for the patient, and of course it's also difficult for the doctor to say, but when does it appear? What did you what did you do, and how it disappears? And is it come every day, or it has is after you eat? Because that's the visceral pain. It comes from a visceral. Liver, pancreas, bladder, exactly. Bladder. So, like for the World Health Organization, if we see what do they suggest to manage the pain, it will always start with analgesics like acetaminophen, or non-steroids anti-inflammatory like diclofenac. I'm sure you have know some of them. Diclofenac, ibuprofen, ketorolaco, ketoprofen. All of them are from the same family. And we will always, they tell us that we will always need to start with this, sometimes even if the person has stomach problems. If we have stomach problems, we shouldn't take non-steroids, anti-inflammatories. That's why they say, I will send you a protector, a gastric protector, which doesn't protect or nothing. It's simply another medication for gastritis. It's not protecting you, it's adding another medicine for all the medicines that you already taken, okay? So if this doesn't work, then we will add an opioid. And actually we have some medicines that come together. Like for example, paracetamol and tramadol, or acetaminophen plus tramadol. That's the opiacum. But it's a very small, not very, very strong opiacum like morphine. It's very small. And if it doesn't work, then we add an opiacum heavier, like for example, in that for persons that are almost dying, I agree that we use the strongest opiacum for that cases, okay? But for normally pain, that's the only thing we have. Remember at the beginning of the talk that I say it's incredible that for so many years We have improved a lot in discovering new kind of type of diagnosis, but with the treatment, it's like with the years, we still with the same things. Just the laboratory changed the names or put something that now doesn't bother your stomach very much, but it's the same with different names. Okay, we haven't not improved at that. So the pain have been a headache for the patients, but for the doctors too, because we said I already gave her tramadol, I already gave her ketoprofen, I already gave her paracetamol, and it's doing nothing. So what else can I do? So a really long time ago, before I went to Hungary, I think I have been, like I told you, since I graduated, I have been studying different therapies. But I think from 10 years ago, Viri, desde cuando yo estudié ozono, sí, sí, yeah, like 10 years ago I studied ozono at Mexico City because I used to live in Mexican state. And I think I really loved it. I really loved it because I say, oh my God, this can help really a lot of people, and it's really natural and doesn't have any secondary effects for you. For me, yes, because if I smell it too much, I can have lungs problems, and of course I smell it every day. But for the patients, it's not problem. And there is a picture where I'm injecting in ozone in the knee of a patient. Okay, so what is ozone therapy? It's effective. Ozone, oh, sorry, no, it's this one. What is medical ozone? Ozone is an unstable odorous, I mean, it smells very, very much. Gas that is made up of 3 oxygen atoms. So what does that mean? This is my little machine, but this is like a Volkswagen, and I would like to have a bigger, okay, the Mercedes-Benz. But this is my machine in my medical room. This is the oxygen. It's normal, like the patients used to have it for COVID. And it comes to that machine. That machine just will send electricity to the oxygen, and it will divide it. Oxygen is O2. It's like you two hold your hands, but maybe you go to the machine. The machine will divide you, separate you, and after you and Brian hold their hands, and you are ozone. Okay, so it's very easy. The oxygen comes to this machine, and after I put my needle, it's called needle in English, isn't it? Here, and it will be with the ozone inside. So it's a gas that is made by oxygen. And we all have been in contact with oxygen. Actually, we live thanks to the oxygen, okay? So the brief history of medical ozone is it was used first time for the First World War to heal, to heal really bad injuries. Yeah, in 1931, Nobel Prize winner Dr. Otto Warburg, who is that one in that picture, wrote a book about ozone and its therapeutic action. So that's a long time ago, 1944. And in 1944 too, the 59th Berlin Congress of Surgeons present a job that it was effect of ozone in the treatment of infected limbs. And in 1953, Dr. Wolf Berlin made the first school of ozone therapy. Right now, ozone has been used in a lot of things, like these big shops like Walmart, I guess, where the fruits are. Because they know it's antibacterial, they clean with ozone. There are a lot of water sailors that clean their waters with ozone. because it's well known that kills bacterial, virus, parasites. So it has been a work for also for that in that places. Which properties have the ozone? Well, first of all, it's anti-inflammatory. Reduce pain, is antibacterial, that we were talking, antiviral, antifungal. So this is fungus, like candida, for example. And antiparasitic. Is a modulator of the immune system and increase the oxygenation. That was very good for COVID. Actually, there was a clinic in Italy that when they had the oxygenation of the patient with COVID, and after it was treated with ozone, they could see that they improved a lot the saturation of oxygen after the ozone. Okay, improves microcirculation and is anti-inflammatory, heal cases of gastritis, colitis, gastritis, ulcers. Sorry, that was in Spanish. Okay, so right now these are really patients from my consult. Okay, this patient, for example, we were very happy because I haven't seen him since I went to Hungary, and after we met by coincidence, and he was actually bleeding, like little drops of, and he had problems with his heart and diabetes. But he went to the doctor, and the doctor always told him, there must be a secondary effect of a tablet that you're taking from the, 30 tablets to 20 tablets that you need to take, but we don't know which is it, so you will need to live with it. And it was very, very painful for the really small touch, very sensitive he was too. And I made a technique that we will see that is bagging ozone with bagging. It's a bag like I can find for Walmart for the fruits, for the vegetables. And if I put the bag, we will see it later. Let me see. Here he is with the bag, you see? And I put the ozone, instead of a needle, I put a stray away to the back, and I close it so the back can fill up, exactly. And we leave the ozone for half an hour to heal, to also kill bacteria, and it's really, really good. I said, why don't we have this in public health center healthcare for everybody? Why not? I mean, I have seen people that have these ulcers for diabetic or varices for bad circulation for 8 years, and they just go, they close, they go to the doctor again, they clean it very bad, the patient suffer very much, after it's open again, needs to take antibiotic. This was we can see it from the first time, the difference. Also, of course, that ones that I'm talking about, it took me like 3 months, but 3 months to close injured that it was for 8 years not treated is nothing. I mean, it's very good and it's natural, okay? So, so I use it because in diabetic patients we have problem of circulation, of immunological, because diabetes is an illness that it's I always say it's an illness of the poorest in the middle of the rich, because all what they need is the glucose, and all the glucose they cannot introduce it into the cells because they don't have the insulin. But all the glucose is in the blood, so instead of blood, it's just like sugar, and this sugar damage the wall of the arteries and veins, but also the neurons, so they can have hit themselves and they will not feel it at the beginning. At the beginning they can feel it like Chile maybe, but after the nerves die they will not feel it, and they have the problem that they don't feel it, but also the problem of circulation, and we need the circulation to heal anything, because the immunologic cells will come, and also the cicatrization will come, thanks that the oxygen and the nutrition that comes through the blood, you see? So if the ozone improve the circulation, also the immunologic system that will repair, because some cells are really like repairing things, and also it's anti-inflammatory, and also it takes the pain low. This is very good and have no secondary effects. Why don't we use it? Okay, so the properties of ozone and other ones, well, in the musculoskeletal system is very useful, because I have used it for osteoarthritis, rheumatoid arthritis, other autoimmune arthritis, like we will say lupus, bursitis, and tendinitis. How can I? Tendinitis. Tendinitis, fibromyalgia, herniated disc and radicular conflicts, carpal tunnel stenosis, plantar fasciitis is very, very good. Very, very good. Almost with neural therapy and ozone. And I have seen so many people that runs, and maybe it's the quality of the floor or the shoes, I don't know why, but a lot of runners have been in the consult with these problems. And ozone is really, really good for that. Carpal tunnel syndrome, I have seen people that they thought they needed a surgery, and they didn't need the surgery after they were treated with ozone and neural therapy without any secondary effects, okay? These are the properties. Antioxidant, we don't need to know this. I left it because in another, last year, it was a doctor here. So I said if he asked me, we can talk about why, because actually ozone oxidates a bit. It's an oxidant. So he will actually stimulate these enzymes that are the ones that make us oxidate. I don't know. When my patients say it in Spanish, I will say it, but I don't know how to say that in English. My patients comes to me and say, they don't say I'm older or I'm old, they say I'm oxidado. Oxidado, you know, like in the presence of oxygen, if I have a metal, it will be oxidized, exactly. So my patients told me, doctor, I'm so oxidized, and I say, yes, because normally in these cells, we have reactions that can oxidize us and also can reduce us, but there is a time and more with our way of life that it doesn't return. I have more to oxidation than reduce, so I will be really in my cells oxidate, you know? So finally, to prevent, not prevent, because we are all going to be older, but there are definitely illness that comes with the age. You will never see a little boy of 8 years old speaking to another one, oh, how's your blood pressure? No, mine is 150/90, you know, yours? No, because if they don't have a tumor in suprarenales, o sea, they will not have this. They can have other kind of illness, normal from their age, but there are illness that comes with the oxidation of the cells, like high blood pressures, like when we start to, even when we are young, and if we get fat, we get all fat. But when we are, the growing hormone comes down and we start to oxidation, it's easier than we still thin, but we see our fatty just in some parts of our body. we lose muscle, we have a lot of changes inside. And it's not anti-aging medicine, but because we are going to be old, but it's like, how can I can have ozone treatments and sweat away treatments, so I can help my cells to live healthier for longer. For example, in my case, I say, well, if I'm going to live 75 years, I want to live it good. Well, I don't want, yes, sorry? Healthy, yeah, I want to live it healthy. Yeah, thank you. That's what I want to. Okay, but how is the application modes? We have so many, okay? Systemically, we have the intrarectal, anal, intrarectal, okay. And we have minor ozone, and local, we have, like you have seen, we can put it here, paravertebral, or we can put it here, or we can put it in the knee, or we can put it here, or we can put it here, or in our hands, or in the tunnel carpian, okay? What else? Oral is because we can, not with my little machine, but with our Mercedes-Benz one, I could put ozone in olive oil and give it to the patient, and I can treat it intrarectal and say, take few drops of olive oil with ozone, and it will be heal also the gastritis without the omeprazole, or without need to taking the omeprazole for a long time. That's why I put oral. Also, you can put ozone in water, but you need to take it as soon probably that we made it. That's why maybe ozone hasn't been really sailed, because it's a gas. So as soon as the gas goes with join the rest of the gas, we have no effect. So if I put ozone in a water, I need her to take it soon. So it's not commercial, it's not to make people rich, because I will not send you water that when you give it to Brian in his house, it has nothing. It will not help him in anything. So the oil, yes. And you can feel like for how long it smells, because the ozone, my clothes all finish smelling very much during my job, okay? Also, we can put creams with ozone, and they sail it. And the bagging, do you remember the bagging that we saw? That means that's embolsado. I'm sorry, there are some that's still in Spanish. This one, I like it very much. This is minor ozone or auto hemotherapy, okay? And it consists of extracting 5 milliliters of blood, which is nothing. That's me, my arm. I'm doing it myself in that picture. Ozonizing it and injected intramuscularly, okay? This is this technique has been done for really long time ago. Again, why if it's so good for acne, for asthma, for allergy, is not used in the hospitals? It's nothing. It's cheap. It's very cheap. And it's very easy. I mean, for a nurse or for a doctor, you just need to take blood and to put it in the intramuscular. And I put ozone, okay? Why is this so good? Because our body is so clever, let's say, intelligent, that he knows the blood needs to be just in veins or arteries. So if I put it in the muscle, they will, our blood will think it's something strange. And we have cells that defend us and also help us to not to be swollen. And that they normally are 8% in our blood, but if there is something strange, they will be ready for the war. So they say to our ocean medulla, hey, make more, liberate more cells to protect us. And from this 8%, they comes to 22%, and that's great, we wouldn't need almost any vaccine of anything, because our body will be like looking for what is wrong. Of course, we will go, what is wrong, and the muscle will not find anything because it's our own blood. But all the rest things that he will look for and that he will find, he will do his job. Because instead of have 8 policemen, I will have 22 policemen watching what is in my body and what not. Immunologic topic is very, very interesting, but I will try to explain it like we were kids. All our cells and all your cells have complejo de histocompatibilidad mayor. That means all your cells say Ana. So you go there normally because our immunologic system have identity. It says, I am Ana, so all when it says Ana, I will leave it. We are peaceful. But if something comes, they will not say Ana, and they start a lot of different and beautiful things in our body. First of all, we have like we call it helper, and it's the one who says, hey, something happens. He say it for 2 of different soldiers. One is immediately, and immediately they're just killer, and actually they are called killer and natural killers, and they go and, oh, you are not enough, and they kill it, they try to kill it, and they leave part of this that is not Ana. They sacrifice themselves, because after will come another one, and it will kill everything and throw it away. But he will stay with one part of this thing that is not Ana to other soldiers to make immunoglobulinas. So after, when you got in touch with this element for a second time, faster will work, you know? I mean, so it's incredible. It's very, very, very beautiful, because we have everything to heal, to defend ourselves. And sometimes if I stimulate with little things that I don't need to give a lot of things to the patient. With little things I can do, the person will tend to heal themselves with their own system, you know? So I have treated this little boy. Which benefits have the ozone? Modulating the immune system, allergies, acne, diabetes, closure of diabetic and varicose ulcers. The same, if I put the bag in and I put the vaccine, the autoimmunotherapy, my patients sometimes say vaccine because it's a vaccine made by their blood. They understand it like that. And herpes, a lot of things. This little boy was from a town, I don't even remember the name, but really, really far away, and her mom told me that he was 7 years old when he came with me, and he was allergic since he was 1 year old. So he have seen immunologic, pediatrician, dermatologic, I mean, a lot of different specialties, and he get cures with his blood. I say, don't thank me because I did nothing. I just took the blood, and well, for the eyes, even the wind was very painful. So he couldn't play. They already changed the bed, the pillows, the games. The mother did everything. For here, you could see the small little things, and here he always was like with the nails, marked nails in his body. And when she told me that when he had flu, he finished at hospital with asthma, because of course asthma and allergy is the same. It's a bronchial that really answer in a very exaggerating way, so it tends to close. So, and I made a cultivo. That's good to integrate both medicine. I took one of the secretion of the eye. We sent it to study. I could see the bacteria that also had it, and I sent some drops and some antibacterial to allopathic, like I learned at school. But for all the rest, I just sent echinacea, zinc, a lot of doses of vitamin C oral, and I took out the milk. I sent it for vegetable milk and sugar. I mean, not honey, he could, but not sugar, white sugar. And I made the autoimmunotherapy or the immunoozone for 10 times, and he was healthy, and the mother was crying because she said, "Oh my God, this is so good. Why didn't we know it? Why we don't know it? That's the question. I mean, why people doesn't know that this exists." Rectal ozone, it consists of the insufflation of ozone through a neonatal nasogastric tube via the rectum. It's like this one, okay? I like it very much because I can introduce like 200, 250 milliliters of ozone. So it's the way that people can be more anti-swallow for chronic, colitis, for chronic diseases, for even people that doesn't like needles. And it's very, like you can see, I mean, this is a neonatal nasogastric. That means that when a little baby that is just born cannot eat, we put this through here to give the food. So it's, can you imagine the size of something that it will go to a newborn person? It's very, very, very little. So have no secondary effects. Or I have used it for hemorrhoids, colitis. It promotes flux oxygenation, stimulates immune and endogenous antioxidant systems. We have already talked about this: arthritis rheumatoid, diabetes mellitus, bronchial asthma, for all the chronic disease that we have talked about, okay? The ozone bagging, this was a patient that already had for one finger was amputated, and he thought it would need another amputation. And this was after 3 baggings plus the ozone minor. Take his blood. Why? Because I need the immunologic system to be, because like I said, this was a patient with diabetes, so his immunologic system is not working, the circulation is not working, so the bagging, and I do nothing. I don't send antibiotic. Actually, if they smell, because normally sometimes they smell, I say just clean it, and just comes just with that clean, so the ozone can be absorbed, you know, and it was completely cured. This was my patient that we already talked about it. He has had, when I first met him, before I went to live in Hungary, he came with a box of medicine, and he said, "My colitis is something I cannot even work, because if I get a bit stressed, I need to go to the toilet." He used to work for Bachoco, and he needed to go to different farms, and it was very uncomfortable for him, because he said, "I need to stop every time. Sometimes I eat nothing. I don't know how to eat, because if I eat small things, I need to go to the toilet very, very, very soon." And he brought me a lot of medicines, and when the first time I met him was just for intrarectal, ozone intrarectal. And he didn't need to take, of course, I also took the milk from the cow away, and maybe I sent him some probiotics, or I also talk him like, well, in case that this diarrhea happens, don't take any more antibiotic until you have a test that says that you really have an infection, but if not, maybe it's your swelling of the colon, so we can take carbon activado and other natural things, homeopathic things that we can mix, and he cured. But if he doesn't cure, at least he knew how to manage. He didn't need to take all these medicines. That's why after he was very, very happy when he heals his hands. And this is my daily job, because if your fat, it doesn't have anything to be with the fat of the people. I mean, I think with the age, we normally dehydrate ourselves. That's why if people are tall, when we get older, we are smaller, because even the disc between the vertebrae comes without water, dehydrated, yeah. And it happens in all our body. We can see it in our skin, that is, it gets thinner and dehydrated, and also it happens here. So if we see a normal knee, there must be a space between this part of the femur and the tibia and peroné. But after, we can see that this space is very little. So for sure, when this person will go upstairs or will do this, they will touch one bone to the other, and that's very painful. And that's called gonarthrosis or arthrosis, okay? So what the ozone, here I do different things. Normally I put ozone for once per week, and also it's anti-inflammatory, it takes the pain low, but also will help me to do this, to separate. Mechanically, it's a gas that I'm introducing, so it will do like this. So my patients always say, I came for my no neumáticos, ellos dicen amortiguadores de aire. From my amortiguadores. The cars have something that when we drive, it doesn't feel it. But in the car it's called?
Yeah, shock absorber. The shock absorber. It's soft. It's like a cushion.
Oh, well, like a cushion.
Like a cushion.
Okay. Well, like I come for my air cushion, they say. Okay, because they feel it. They say, oh my God, I always explain to them, you will feel that some air is introducing it into your joint, so it will feel a bit strange, yeah. And but after, when they see they can walk without pain, they say, oh my God, yeah. And after, we call regenerative medicine, because after 4 of ozone sessions, we put something called hyaluronic acid. This is from allopathic medicine. It belongs to a Sanofi laboratory, something like that. It's very expensive. Each needle is for one knee, and it's like 13,000 pesos. So if we do the ozone for 4 sessions, and after we put the hyaluronic acid, that is the oil, for sure the person will be without pain for at least 4 or 5 years. The thing is that if you put a knee supplementation, it will work for 5 years too, and sometimes you don't finish very good from the surgery, so it's at risk. And every surgery is a risk. And both of them are natural, because I work I live in a very, a small town. I live in Oman, is where I see my patients. Sometimes they don't have the money. So I make plasma rico en factores de crecimiento, plasma rico en plaqueta. I take the blood of the patient, I put it into a machine that goes very, very, very fast, a lot of revolutions per minute, and separate that blood. Centrifuge, yeah. And after, with the plattles, and I put it here, so I simulate natural the the oil, the production of the oil, you know, but that is like I can ask for 700 pesos, which is very different, $13,000. Maybe I need 3 or 4 sessions, but it helps people too. Okay, local ozone, well, these are patients that goes because they have problems with your back. Normally, sometimes I use neural therapy, is based by procaine, it's also natural. Procaine is an anesthetic, but we don't use it with the finality of put anesthetic in the body to repolarize electricity. We put it just to remember this, to remind the cell how does she works after a rest. Let's explain it like that. For example, if Anna feels bad and maybe I send her some medicines, but after I say, okay, now, but you need to go for holidays. And sometimes patients have told me, I went to holidays, I didn't take what you sent me, and I get well. And I said, well, maybe a lot of your problems were because you were under stress or you were overusing so many things. And this happens. If I have migraine, it's because I think a lot and I overuse sometimes my brain. If I have gastritis, it's because I overuse myself of my stomach and I'm producing more acid that my own wall of my stomach resists. So it's always, sometimes it's because we have day and night and we need to rest and sleep at night and work during the day. It happens the same with the cells. It's incredible, but if naturally I can make cells relax, and I do it again in another session and again in another session without any pharmacy, maybe they start to work again, you know? Did I make myself understandable? Did you understand? If not, you can tell me. But neural therapy gives a rest, and if I put a local rest, because it's not a tablet, it is local, I put it in the knee or I put it here. If I give rest to any part of the body, and there were swallow and an inflammation, for sure after rest, the inflammation will come back. Actually, the orthopedics, if you have a esguince or blood broken, they will put something for you to rest the joint. You see, because and we say, well, esguince, okay, you need to have this for 10 days, because after you rest the joint, the inflammation will come down and the pain too, for sure. Okay, so, but this is, the neural therapy will give a rest in the cell, inside the cell. Okay, so if I put a rest and in a area of my body, and the inflammation comes down and the pain comes down, and also I put ozone, that is an anti-inflammatory gas, and that dulls the pain, both of them are a very good mixture. Okay? Also I put it in the swerms, I put with vitamins, I always put procaine, because procaine is very, very good for that. Okay, and after these patients was treated with ozone for his back, I think, Viridiana, you have to be treated with ozone for your back and neural therapy, don't you? And after that, I most of the time I show them how to prevent not to have the pain again, because sometimes we think back pains are because we are doing some exercises and we can tend to not move, and that's worse. The thing is that in Occidental countries, we don't have any exercises that really helps the paravertebral little muscles. And yoga and Tai Chi are very good for them, but even if we go to a gym, we we are not moving these little muscles from one vertebra to other. And because we don't move it, it's like any muscle. If I don't move it, they get weak. And after this falls down, I will take it and go, Brian, please help me, I cannot move, what happened? And it's just because I didn't use it. But if we learn how to stretch them, we can prevent it. So normally after the treatments, I really like to teach my patient, we do it together, you do what I do, and things like that, no? Okay, aesthetic ozone. Okay, actually I have both ozones. I have one machine that throw the ozone, but ozone that you can smell, and it's for aesthetic, and it will help also to, for example, if I do hydration or something, to absorb it better, okay? And I also have this little machine that I use for my patients for acne, but also with ozone minor. I mean, I take the blood, I put it in the muscle, because acne is also, normally allopathically, I would treat it with antibiotic. And so instead of antibiotic, I treat it with ozone that is natural, and but different, I use different, like I told you, I integrate, but it's a very individual consult, okay? Well, that's it. Thank you very much. Do you have any question about the ozone? Paulina, do you have any question about the ozone therapy? Or pain or whatever? Yes, Anna.
So it's a temporary treatment, the ozone, is that what you're saying? So you're not, is that how you would describe it, a temporary treatment, and then you just come back for another?
No, it depends of, for example, the little boy that used it for allergic, I didn't see him again. Well, I have seen it because he has something like a flu that could be treated in his town, but his mom, no, I brought it, but I haven't seen him again for the allergy, okay? My patients with acne, I haven't seen them anymore. I mean, for acne, for asthma, for allergies, for some, like diabetes, I have used it, ozone minor, and the diabetes, the patient is still with diabetes. The thing is that before he used to take a tablet after insulin, and the glucose, it was always 400, up 400, and with the ozone therapies, it came like 200. That for that patient was very much because he wasn't painful. So for each case is different, but for this chronic. For example, the minor ozone, I use it every year for me and my family when my family is with me, because I know I prefer this than normally vaccines, okay? So I use it to prevent, I use it if I know that I will be stressed and my immunologic system can come down, or I see a patient that it was very, very sick, I say, oh, I don't want to get sick, so I take my blood, I put it. And I normally use it at least once per year. But there are illness that you can treat ozone as a unique therapy and will be cured, like the hole. After the hole is closed and is healed, I don't need to see that patient anymore. But there are some other cases that, yes, for example, I have put it in the knee, and there are patients that they didn't have the pain for 2 years. After I came from Hungary, they say, just on time, because I'm starting to feel it again, but it's just 4 sessions, and the hyaluronic ACE, and another case, I have seen the patient after 4 years, so it's good, you know? With neural therapy, I have treated throat, and I have patients that telling me, oh, do you know some, because Venezuelan people, we are all around. And I receive calls about my patients, like, do you know a doctor that's what you do in Spain? Because since I always had throat pain, and since you inject my throat, I didn't have any throat problems for 12 years. So I'm recommending, but I don't know anyone to do this. So sometimes it's for good, but sometimes, of course, no, it's not for good. I mean, there is so many oxidations in the cells of that person, and It's not miracle. Also, the minor vaccine, the minor ozone has a problem. After 7 years, you have nothing in the muscle, so you don't you have nothing to stimulate these white cells from the immunological system. That's why it's the only, for example, serums, neural therapy. I can even put it twice per week if the patient wants it or need it. But the minor ozone, I say no way. I need to do it 1 week, because if not, I will be stealing the patient, because after 8 hours I put the blood in the muscle, these white cells that protect us and check all what is wrong and repair everything, they come from 8% to 22%, but they will stay like that for 5 days. After 5 days, of course, the blood is not in the muscle anymore, it's already reabsorbed, and it's nothing. And when it's nothing, it comes down. So that's why for allergy, asthma, diabetes, I say you need to come every Tuesday. If your day is Tuesday, come every Tuesday, because every 7 days, I will do it for 10 days, for 10 sessions to see the difference. But that's for allergy, asthma, diabetes, but we'll have a different answer, depends of why I'm using it. Yeah, but for example, for the pain in the knee, yeah, like the forsations, and every patient is different. Sometimes I say, why didn't you come? And well, because I feel good with the second dose. Or for example, doctors doesn't likes to talk about. We like to talk about how good I did, but not about my failures, my things I haven't done good. For example, with Ty, I haven't helped her for something that he went to my consult, but I wanted to help her for another thing, and she had a pain, and I put her. What did I put you? Neural therapy. Well, I put ozone. Okay, well, ozone and neural therapy, and I don't have her permission to say what was the other thing, but with one session he said, Sena, I don't feel the pain that I used to have here. I feel very much different. And I said, okay, that's very good, at least, you know. So sometimes I have this with also neural therapy, very, very often, that, for example, for plantar fasciitis, that I said, you need to come 4 times, and after 2 times, they call me, but I'm completely fine. And I said, well, you should come to be sure, but sometimes not even 4 sessions, the pain is gone. If it's a fasciitis plantar, if it's a problem that was a mechanical problem, I did a bad movement, and it's not something really chronic, maybe with some, but it's a very, very good option for sure, both of them. I always say, if also I reach this to put low the pain, and with neural therapy, I reach almost the same, but there is something in medicine that we call synergia. A synergy is like, if I would do both, if I do one, I will have this result, and if I do the other one, I will have this result, but if I use both, I will have maybe this result. So, because one put a rest, and the other one is actually an anti-inflammatory by themselves. So at the end, we are treating in different ways the same thing, but in different ways. Does any other person have another question? Thank you for helping me, Anana. I don't know, it's very difficult because of course at BP and last year even here, that I was talking about, how was the name? What was the name, Ty? Wellness, no, positive.
The topic was?
Yeah.
Positive, like positivity, thinking positive.
Yeah.
How you are just so positive. I hear you all the time.
Yeah, because I said in Hungary, like Mr. Scott said, when I was working in BP, people stopped me. Oh, are you from Iberia team? I was from Iberia team because I needed to speak Spanish to the clients who were in Spain. And I said, yes, how do you know? You always smile. And they were always serious. And I said, why do I always smile? Well, and I started to think, well, there's a history. They have a very sad history with wars and a lot of things that I didn't have. But maybe they have more money now, but we like Latin have another things, and maybe I can put that in a talk. And I did it volunteer, and people started to come and see my talk. So I did it last time here because I said, yeah, maybe a lot of people from USA and Canada also feel maybe sad, even that we think, oh, they have money and they are retired, but maybe their families are far. So it's good to reflect about this kind of things, no? So if I move, why I still don't have, maybe it's other thing. So I gave this topic last time, but I have never spoken about medicine in English. I always do it to my patients in Spanish. So really, thank you very much for helping.